Assalamu alaikum, students. Today I am here again with one important topic. It commonly asked as the short notes in your theory exam, and it's clinically important for any type of doctor working in ICU, emergency care, or in orthopedics. So before starting my videos, I just want to remind you why my videos are important. They are very concise, exam oriented, and will help you in writing short notes and long answers in your final exam. And secondly, I'm just covering one topic in each video, so you can see a topic of your interest anytime. So before starting today's video, actually I was browsing for a clinical photograph of building falling downs, and whole Google was filled with the falling buildings in Palestine due to the ongoing war and the attack on the Palestine. So I can't resist myself sharing solidarity and support for Palestine. So with prayers for them, I'll start my video today. So what I have today. So it's a if you have some attack or some uh, what you call earthquake or anything, there are fall of the buildings. So many people who are inside the building will die immediately due to compression injury over the head and chest. A few will survive and they will reach to the hospital. So they have massive muscle damage. So if there is massive muscle damage over the period of time, they land up in crush syndrome. So here is the picture. There are fall of buildings and people are getting uh, injured inside the building. So many people, they will die of direct head and chest or abdominal injury, but people who survives of this accident, they will have so much muscle damage that over the period of time, they are having high risk of developing crush syndrome. So to define crush syndrome, we need to know three things. One is crush injury, crush syndrome, and compression syndrome. Crush injury, it is assault or insult due to the direct physical crushing of the muscles. So it is affecting only the part of the limb due to direct pressure of the muscle. But over the period of time, the crushed muscles metabolic changes are produced due to injury of the muscles, such a severity to cause the disruption of cellular integrity. So there is loss of cellular cell membrane or muscle damage and release of its content in the systemic circulation. So if you see, due to the fall of the object over the limb, there is crushing of the limb. So this is called as crush injury. After the crush injury, there is damage to the muscles and blood. The muscle products enters into the systemic circulation, and patient has systemic presentation. The group of various clinical presentation, it is called as crush syndrome. So crush injury is just involvement of the limb. Crush syndrome is the systemic manifestation after the crush injury. What is compression syndrome? Compression syndrome is variant of crush syndrome where you have not a very heavy injury at a time. It is slow compression of the group of muscle. So slow compression for longer period of time cause ischemic damage and patient may land up in crush syndrome. So crush injury is an acute injury where heavy object is falling on the limb and crushing the muscles, causing damage to the muscle. So once this damaged muscles, there is destruction of cell membrane and the products inside the muscles enters into systemic circulation, presenting as a multiple systemic involvement. It's called as crush syndrome. Compression syndrome is a slow variant or a chronic compression variant of crush injury. So what is happening after the crush injury? 80% of crush injury, the people will die at the site of accident because they have severe head injuries and severe chest injuries. Whereas 20% survive after the massive crush injuries. So this out of 20%, 10% will have uneventful recovery, whereas remaining 10% will develop crush syndrome. So what is happening in crush syndrome? There is destruction of the muscles or the tendons. So their product is entering into the systemic circulation and affecting the kidney and other system. Okay, this is the pathology behind the crush syndrome. What is happening? There is compression of the micro and macro vasculature of the muscles and muscle tissue themselves. So this causes destruction of muscle tissue. Once that muscle tissue get destructed, their products enters into the systemic circulation. That like myoglobin, potassium from the muscles, magnesium from the muscles, phosphates, acids, and enzymes. Enzymes like creatinine kinase of muscle type, and lactate dehydrogenase. These are the enzymes which enters into the systemic circulation after patient have muscle injury. So when the patient have this muscle injury to the muscles, these substances are ready to be released into the systemic circulation. So once the source of compression is released, there will be reperfusion of the ischemic damaged muscles. So once the reperfusion happens, this molecules or these agents enters into the systemic circulation. So when they enters into the systemic circulation, they manifest as crush syndrome. They manifest as crush syndrome. So crush injury, when reperfused, the damaged muscle products enters into the systemic circulation and manifest as crush syndrome. So what is happening? After the injury, the myoglobin is released into the circulation. This myoglobin is converted into methmyoglobin. This myoglobin converted into acid hematin. So myoglobin, methmyoglobin, and converted to acid hematin. This acid hematin, which is released into the circulation. So there are two mechanisms of injury. One is by mechanical obstruction. What is happening is myoglobin enters into the glomerulus, filtered through the glomerulus. In the distal convoluted tubules, they forms precipitate. So here they are forming the precipitate and blocking the flow of the filtrate. So what is happening? Myoglobin getting filtered into the glomerulus. It precipitates in distal convoluted tubules, causing obstruction. The second is myoglobin degraded product like methmyoglobin or acid hematin causes vasoconstriction of the afferent arterioles. Afferent arterioles, the arterioles coming to the glomerulus, they are going into vasoconstriction. Once they enters into vasoconstriction, there will be renal tubular destruction. So in either way, there is damage to the kidneys. So patient will have acute kidney injury. Acute kidney injury either due to the mechanical obstruction by precipitate or chemical destruction. Then patients start having systemic manifestation. So what is the clinical features? So local, the features related to the injury in the form of bruises or blisters. Then patient will have myalgia, muscle paralysis, and sensory deficit depending on the limb involved. Systemic wise, there will be petechial hemorrhages. Patient will have fever. Fever is due to inflammatory products entering into the systemic circulation. And patient will have cardiac arrhythmias. Reason for cardiac arrhythmias is increase in the serum potassium. So muscle lysis increases the serum potassium, so patient will have cardiac arrhythmias. And when you see the color of the urine, patient may either have oliguria or patient may have very dark urine. It's cola color urine or tea colored urine. And when there is increase in acidosis, patient will have nausea, vomiting, and involvement of central nervous system. So basically, the first system could get affected is kidney. So patient will have renal shutdown followed by cardiac manifestation and central nervous system involvement. So how will you diagnose crush syndrome? Crush syndrome is basically again a clinical diagnosis, but we need to monitor various parameters, electrolytes, and other reactive substance in the blood. So creatinine kinase, serum aldolase, serum myoglobin, and myoglobin in the urine also you can see. Then lactic acid, patient will have hypocalcemia, hyperglycemia, and altered acid base. I mean, if you do ABG, there will be alteration of the electrolytes and acid parameters. And there is ECG changes in response to hyperkalemia. So how will you treat? Once you have diagnosed, it's an emergency treatment. The patient, the risk of losing patient is very high if delay in the treatment. So we need to have proper rescue after the injury, and we need to resuscitate, then recognition of this one, and start treatment and rehabilitation as early as possible. So we need to do is supportive care. So patient will have loss of fluid loss in after the crush injury. So we need to give the fluid replacement and monitoring the amount of fluid replaced by monitoring blood pressure or central venous pressure. And there is renal shutdown. So you need to give forced dialysis with administrating mannitol to the patient. Then dialysis. It helps very much when patient is having hyperkalemia, if it is more than 7. So dialysis is life-saving for this patient. Then you can give hyperbaric accession. You need to give antibiotic because there is open injuries and high risk of infection and high risk of tetanus. You need to give tetanus immunization to the patient. So all this treatment is directed towards the supportive care. Supportive care for central cardiovascular system, renal system. Okay. Then when you have very massive injury, you need to give proper debridement so that the crushed and damaged muscle should be removed and there is no more secretion of the active myoglobin or other products into the systemic circulation. If you are suspecting compartment syndrome, you need to do fasciotomy and damage control orthopedics. So to decrease the secondary damage after the fracture to the limb involved, we need to put a external fixator and temporarily immobilize the fracture. External fixator application. Lastly, if you feel that the limb is completely gone, there is no chances of surviving even after reperfusion, better to do amputation, because if you reperfuse a damaged limb, then there will be secretion of these all active products into the systemic circulation, resulting in a systemic manifestation of crush syndrome. So always it's whenever possible, I mean, the limb is not salvageable, it's better doing amputation than complicating the patient by entering into the systemic circulation. So I will end my topic today with one words from इकबाल है खाक फलस्तीन पे यहूदी का अगर हक हिस्पानिया पे हक नहीं क्यों अहले अरब का. So please pray for the Palestine. Inshallah, see you in next video. Subscribe, like, and share the videos. Thank you.